Bone augmentation and implant dentistry, enhancing bone density for success. When it comes to dental implants, one of the most important factors for success is the amount and quality of bone available in the jaw. In cases where there is not enough bone present to support an implant, bone augmentation procedures can be performed to enhance bone density and ensure the longevity of the implant. What is bone augmentation? Bone augmentation, also known as bone grafting, is a surgical procedure that involves adding bone or a bone-like material to the jaw in order to increase its volume and density. This procedure is typically done before or during the placement of a dental implant to provide a stable foundation for the implant to integrate with the surrounding bone. Why is bone augmentation necessary? There are several reasons why a patient may need bone augmentation before receiving a dental implant. Some common reasons include severe bone loss due to periodontal disease or tooth extraction, trauma to the jaw, developmental abnormalities, inadequate bone density in the implant site. Without proper bone density, an implant may not be able to withstand the forces of chewing and biting, leading to implant failure and potential complications. By undergoing bone augmentation, patients can improve the chances of a successful implant placement and long-term stability. Types of bone augmentation procedures. There are several different techniques used for bone augmentation and implant dentistry, including bone grafting. In this procedure, bone tissue from another part of the body or a donor source is transplanted to the deficient area in the jaw. This bone material may be harvested from the patient's own body, autograft, a cadaver donor, allograft, or a synthetic source, alloplastic. Sinus lift, also known as a sinus augmentation, this procedure involves lifting the sinus membrane to create space for bone grafting in the upper jaw. This technique is commonly used when there is insufficient bone height in the posterior maxilla for implant placement. Ridge expansion. This procedure involves splitting the jawbone to create a larger space for bone grafting. Ridge expansion is often performed when the jaw is too narrow to support an implant. Socket preservation. After a tooth extraction, bone grafting material is placed in the empty socket to prevent bone loss and maintain the volume of bone for future implant placement. Each of these techniques has its own advantages and considerations, so it is important to consult with a dental professional to determine the best approach for your specific needs. Benefits of bone augmentation. Bone augmentation offers numerous benefits for patients seeking dental implants, including improved implant success rate. By enhancing bone density, bone augmentation can increase the chances of a successful implant placement and integration with the surrounding bone. Enhanced aesthetics. Bone augmentation can help create a more natural-looking smile by providing adequate bone support for the implant restoration. Long-term stability. Proper bone density is essential for the long-term stability and function of dental implants, ensuring that the implants can withstand the forces of daily chewing and biting. Preservation of facial structure. In cases of significant bone loss, bone augmentation can help maintain the natural contours of the face and prevent sagging or premature aging. In conclusion, bone augmentation plays a crucial role in the success of dental implant procedures by enhancing bone density and providing a stable foundation for the implant. With various techniques available, patients can rest assured that there are effective solutions to address their specific bone deficiency needs. If you are considering dental implants but have concerns about bone density, consult with a dental professional to explore the benefits of bone augmentation and determine the best treatment plan for your oral health.